Gum disease is a chronic bacterial infection of the mouth, particularly in the gums, and then affecting the jawbone as well. It's characterized usually by a buildup of tartar, and then bacteria that grows within the tartar gets down below the gum tissue. As it deteriorates the gum tissue, it can progress and start to deteriorate the bone as well. And since tissue and bone are what hold teeth into place, long-term progression of gum disease ends up in tooth loss. There's other factors as well. You can have side effects of malodor, bad taste, discoloration of the teeth, shifting of the teeth, and unfortunately it can also be asymptomatic, meaning the patient doesn't even know that they have gum disease. It's definitely treatable, but something that you'd want to catch early on so that it can be corrected to prevent, again, long-term tooth loss. Occasionally a patient won't know that they have gum disease. It can be asymptomatic, so sometimes they'll report pain in their gums, little discomfort, tenderness, bleeding of the gum tissue when they're brushing or flossing. You can have a little shifting of the teeth, discoloration of the teeth, malodor, meaning bad breath, bad taste. Can be any sort of mix of those symptoms, but unfortunately, if you don't have any of the symptoms, the gum disease can be progressing without you realizing it. Gum disease is certainly preventable. It's a slow progressing disease, so if it's caught early, the treatments needed are not really difficult. It can start off with some simple bleeding gums, tender gums, and we can go in and do what's called a deep cleaning. Deep cleaning is a way for us to clean deep under the gum tissue. We numb the patient so that they're comfortable and they don't feel anything. It's very similar to a regular cleaning, only we're going to remove tartar that's deep underneath the gum tissue where the bacteria lies. When you flush out the bacteria, the gum tissue can then heal. So you definitely want to treat gum disease. If left untreated, it can cause systemic health issues, meaning whole body health issues. It's been linked to cardiac problems, so heart problems, and you can also have, in pregnant women, low infant birth weight. So there's issues besides just your mouth that you want to address. You don't want to leave a chronic infection anywhere in your body, and you don't want to see the effects of it spreading.